Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello, and welcome to another episode of the Healthcare Connections podcast. I'm your host, Jeremy Winn, and I'm really excited for today's guest. We've got David Zetter with us. He is the founder, president, and CEO of Zetter Healthcare. He does it all there. And he's been a longtime partner of ours here at Healthcare Compliance Pros. So we're really excited to have him. David, thanks for joining us today.
Thanks for having me, Jeremy.
Yeah, I'd love to give you a chance, David. There's so much that you do in your business. I think it'd be really valuable for our listeners to let you give a more thorough introduction. There's certainly, I couldn't sit here and do it. But I'd love to have them know more about you, your business, your background, all the things that you're focused on.
Sure. Well, I've been in business literally since I was 14. Ran all kinds of businesses, always trying to make money.
Yep.
But about 25 years ago, I left running thousands of restaurants to get into healthcare. Went to go work for a consultant, an accounting firm that did this. And basically, I spent 5 years learning everything, getting certified in about 17 different certifications to become an expert at everything. Took over the consulting side of the business, separated, and we've been running at 150 miles an hour ever since. We work with healthcare facilities, practices in all 56 U.S. territories. We do have clients everywhere. We probably credential and contract somewhere in the neighborhood of 10,000 providers a year.
Wow.
We're probably one of the largest credentialing firms in the country, at least from the number of providers that are done.
Yeah.
All of our business is 100% referred to us. We don't advertise whatsoever. And we just keep trying to do the good fight for all those healthcare providers, because trying to make money in healthcare is not easy when you have insurances trying to take the money back.
Yeah, absolutely. Yeah, we're seeing a lot more of that, unfortunately. So I've got to ask, what kind of restaurants? I just need to know.
I used to work for a company called Jericho Incorporated, and they owned a lot of restaurants. One that you definitely know is Long John Silver's, but we also had full service Italian, Bella Notte, fast food Italian, Fazoli's, Jerry's restaurants. I mean, all that kind of stuff. But I ended up as an executive VP after working there 20 years. We went through a leverage buyout, and I just knew I needed to get out of restaurants. I was traveling 5 days a week, didn't see half of what my kids did when they were growing up. So I was sick and tired of traveling all the time.
Yeah, thank you. Yeah, I just needed to know when you mentioned that. I didn't realize that about you. That's great. Well, thanks, David. I appreciate that thorough introduction. I think for our listeners, that's really good to know all the things you're working on. So I've got a couple questions today for you that
Sure.
I think would be meaningful. So we now officially, we're recording this here at the end of January. We have a new administration up and going. Certainly there's still some nominees that need to be officially approved, but it's looking like some of those things will happen. So what are some of the key things, with the new administration that practice owners, administrators should be paying attention to?
Well, one of the main things right now that everyone's trying to pay attention to is, with all the PHE, the health waivers and all of that stuff from COVID, that's all ending, but Congress can't make their minds up on what they want to do. Yeah. So we've kind of kicked the can down the road till March 31st on some of these COVID waivers. And the main concerns are telemedicine, telehealth. Okay.
Yeah.
So everybody set up we set up hundreds and hundreds of telemedicine practices over the last few years. And, everybody's doing all this telehealth and telemedicine now, running their businesses. And now Congress wants to basically stop it, meaning that the only people they're going to allow doing it is if you're in a rural health area.
Yeah.
And the patient has to be in a facility. They can't be at home. They can't be in a medical practice, things like that. So you have to be in a qualified facility in order to do that. And that's what the
Hmm.
plan is at this moment in time, at least come March 31st. We're hopeful that Congress gets its act together and realizes, okay, you put everybody in this situation over 4 years,
Right.
everybody's used to it. Now you're going to pull the rug out from
Yeah.
underneath them.
Trying to
I mean, that
unwind
just
that
doesn't
is
make
a
any
mess.
sense
Yeah.
whatsoever.
Yeah. Unwinding that's going to be difficult and disastrous.
Yeah. So, I mean, they've got to make that change. They've got to allow it to move forward. Every patient has gotten used to it, being able to do this type of thing. So
Yes.
you don't go ahead and, change the rules, allow everybody to do everything, and then say, oh, no, we're making a mistake. We're going to go back to what we did.
Yeah.
Um,
Interesting.
I really don't. I think this new administration, well, obviously thinks much differently than the previous one.
Yeah.
But I hopefully they'll get smart and realize that we need this in healthcare. We do.
Yeah.
You have a
Absolutely.
shortage of primary care. You have a shortage of all kinds of physicians out there. So they've got to find ways in order to get product and get care to the masses.
Hmm.
And telemedicine is the only way this is going to work, given the situation that we put ourselves in.
Absolutely. Yeah. And yeah, I think that's an important thing to watch. And you said March 31st is kind of the deadline right now.
Right now, who knows whether they kick the can down the road a little further. I mean, it's no different than what they've done with Medicare reimbursement for years. When they had the change in all the calculations, they keep saying, "Oh, we're going to
Yeah.
stop the reduction in payment," and they stop it for 4 to 6 months, and then we've got to wait for Congress to figure out what they're doing again. I mean, how about we just get Congress to do their job?
Yeah. It's hard. It's hard to run a business when the rules are changing all the time out of your control.
Exactly. So, I mean, that's a big thing. Then we've got the possible changes to Medicare reimbursement.
Yeah.
I mean, different administrations think different ways. Everybody's been trying to go to value based care. I mean, let's face it, fee for service is never going to go away. If
Yeah.
anybody wants to quote me on that, that's fine. I'll live and die by that quote, but it is not going away. Value based care, yes, there will be more of it, but it's not going to replace fee for service.
Yeah.
It just can't. It's not possible.
Yeah.
So we're going to have both. It just depends on what their game plan is in order to fix this and quit kicking the can down the road. We've got to make permanent fixes here.
Absolutely. Yep. I agree. I think that's important. Okay. I think that's great. And the second question that I want to get to, because I hear it all the time. People ask us a lot about it. From a compliance perspective, we have artificial intelligence that's all the buzz, all the rage out there, especially in
Sure.
healthcare. It's continuing to emerge as a trending topic. So I'm curious, where are you seeing this work? That's kind of my first question when it comes to artificial intelligence. Where are the benefits so far that you're seeing?
Well, I mean, from in everything that I do, I mean, we work in every aspect of the healthcare practice. I mean, whether it's their marketing and advertising or, even documentation and patient visits, things like that. I think AI is going to get into everything.
Yeah.
Um, I don't think it's a complete negative. Yes, there are definitely negatives
Yeah.
to it. You've got to be careful. You can't just go in there and say, hey, write me an article about this malady so that I can put it on my website, my, health practice website.
Yeah.
You've got to make sure it's accurate,
Absolutely.
because you're going to be held responsible and accountable for what you're communicating out there. And if it's not accurate, and a computer generated a bunch of information that you come to find out isn't accurate, now you're going to be in trouble.
Yes.
in some way, shape, or form. So I think you just need to do your homework. You've got to read through everything. You can't just leave it alone and assume it's going to do everything for you. But I think it can be very helpful. We're using it in writing articles. We're using
Hmm.
it in doing documentation, in EHRs. We're
Yeah.
using it in evaluating data and analysis of claims and things like that. So I mean, there are many different ways you can utilize it. You just need to make sure that whatever data and information that and feedback it's giving you, it's accurate, you approve it, and you need a human eye to look it all over just to be on the safe side.
I love it. You kind of answered the second question I was going to ask is, not only where is it working, but what advice can you provide? But I think you really drilled that is, use it, right? There are some really good use cases, but make sure you don't totally eliminate the human element of things. We do that as well on our end as we're writing some articles and some blog posts. We'll use AI for structure and to help with some of the content, but we have a standing rule that this has to be approved by our compliance team before anything goes out on our blogs. Because the last thing as a compliance company that we can do is actually mess up our advice on compliance and just assume that AI is gonna have it all correct. So
Exactly. Exactly.
great advice, love that. Uh, Topic three, I think again you do so many things when it comes to helping practices, manage all aspects of operations. What's the biggest challenge that you're seeing facing medical practices today?
Dealing with insurance companies. I mean, literally, we've all been through the whole Change Healthcare nightmare. United
Yeah.
Healthcare, let's face it, United Healthcare is probably, well, in my opinion, the worst insurance company on the face of the earth. They could care less about anything that's going on with the patient. They will deny claims just for the sake of denying them.
Hmm.
Payers recoup on claims that they're not allowed to. Federal law does not allow them to recoup on an ERISA claim. And that's a claim that is a health plan sponsored by an employer that is
Hmm.
not a government entity or a religious entity.
Yeah.
And that means unless the payer has notified the patient and the employer that they are not paying that claim or that they're taking money back, they cannot do it legally. The problem is they get away with it because all of your listeners don't know the laws.
Yeah.
So they get away with it because you don't know the law and you think that United Healthcare knows all the rules. And let's face it, most people at insurance companies read scripts, they're coached on what to say, and they don't have any clue as to what they're talking about.
Interesting.
So if you educate yourself, you can hold payers accountable, keep the money that you've been paid, force them to stay within the rules, and make sure that you're successful. And that's what we try to do for everyone that we're helping. We want our clients to be successful. We want them to understand the rules. We want them to be able to hold whoever their vendors are and partners are in healthcare, hold them accountable to do the proper job and to help them care for their patients in better quality, in better care, in better scheduling, and to get paid for the services that they so rightfully deserve.
Yeah.
So it's all about holding those payers accountable. It is a massive job. There's a lot of us trying to do this,
Yeah.
but it's very hard. I mean, I've been speaking for 20 plus years in healthcare and just trying to get everybody to understand these rules. It's difficult. That law is over 50 years old. It is not new.
Yeah.
And why people don't know about it, I just don't understand. But that's the biggest challenge is making sure that whatever bills that you're submitting for your claims, you're getting paid for them and getting paid timely. I mean, even every state has managed care regulations that were passed. I can show you all kinds of laws that tell managed care providers, meaning insurance companies, you've
Yeah.
got this long to pay a claim. If you go outside of that, you've just violated state law.
Yeah.
And that there are a lot of those laws in a lot of states, but most medical practices don't know it. And they're sitting there waiting 60, 90 days to get paid. Or you've got somebody that says, oh, we're denying the claim. You need to send us medical records. In some states, you've got 14 days to pay that claim, and that's it.
Wow.
You don't get to request records. So that is probably the biggest challenge, is holding payers accountable and teaching and educating our clients how to do so.
Yeah, no, that's really helpful. I think a lot of listeners are going to be interested in now diving deeper. Okay, I need to educate myself better on these laws. So that's valuable, right? As reimbursements, right? They're always trying to bring reimbursements down, and you know, practices making less and less money seems like every year.
Absolutely.
It's the trend, like you said. Congress and others have to step in, and you've got to find a way to build in some long-term solutions so that everybody in the industry can count on it and say, all right, now I can build my business around the rules, and I know they're going to at least stay mostly concrete for a little while. That's to me is such a huge challenge.
Absolutely.
Okay. Well, with that, let's give a chance. You know, if anybody is interested and said, hey, I need to better understand these rules, particularly around, you know, the reimbursements, what's the best way they can get a hold of you, David?
Well, the best way to reach me is either give us a call at our office. Our phone number's on the website. The website is literally my last name, zetter.com, Zetter. Like I said, we help clients all over the country. If for some reason it's something we don't have expertise in, we can refer you to somebody that does. I'm a past president of the National Society of Certified Healthcare Business Consultants. That's a brain trust of over 300 other consultants in this country. So if I don't have an answer, my colleagues do.
Yeah.
And we'll get the proper answer and get them situated properly so that somebody can help them and help make them more successful.
Love that. Thanks, David. And to our listeners, you know, we're so grateful to have you on. I'm sure they're going to pick up a lot of valuable information from this episode today. So for those that are listening, reach out to David if you've got you know, some needs, you know, really on anything on managing your practice. He can help you, as you mentioned, or he knows an expert in a certain area. If it's not him, he can find one for you. And if you need compliance help, again, reach out to our team. My email, jwinn@hcp.md, is the best way to get a hold of me, and we can help you when it comes to the compliance perspective.
Oh, and you guys do a great job too.
Thanks, Dave. I appreciate it.
You help a lot of my clients, that's for sure.
We've had a lot of fun with the partnership over the years, David, and we appreciate your partnership. Thanks for joining us, David. Thanks everybody for listening. Again, you can catch this podcast every single week, and this has been a fun one. Appreciate it, David.
Thanks, Jeremy. Have a great weekend.
You too.
Take care, everyone.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwinn@hcp.md. Don't forget to tune in next week. Thank you.